Hey, we are back for another episode of Mind, Your Body, and Soul, the Healthy Podcast. I am Joseph Ward, and I'm here this week with none other than Miss Alana Steaple, aka Dr. Staples. Miss Steeple's. How you doing?
Steaple?
Right. Yeah, I forgot about that one, the Steaples. How you been?
Pretty good. Yeah. It was World AIDS Day was
Yes, got to
yesterday.
get definitely got to get into that. Yes. I want to shout out to Mathias. He couldn't make it today. We got a million things going on, so that's why we are happy to have different team members who understand and get the whole concept of what we're doing here in our Ryan White program, but also with this podcast. So, if this is your first time, this is the world's greatest health podcast. This is Mind, Your Body, and Soul, the Healthy Podcast. And Mind, Your Body, and Soul is an educational podcast that focuses on all things health related to help our listeners learn more about various health topics and information they may not have access to. We seek to inform, empower, uplift, and mobilize our listeners to become the healthiest versions of themselves. And you can catch us normally every Wednesday on our website at www.nmcpodcast.com or our YouTube channel. Go to YouTube, type in Neighborhood Medical Center, and we go to the Neighborhood Medical Center page. Make sure to subscribe. You'll see the Mind Your Body and Soul podcast. We're also available on Anchor, Breaker, Radio Public, Pocket Cast, Spotify, Google Podcasts, and a whole bunch more coming up. So we are
Right
out
now.
here. So make sure you check us out once again, www.nmcpodcast.com. And got a couple of announcements before we get things started. Like Miss Steeple said, yesterday was World AIDS Day.
Mm-hmm.
Yesterday, December 1st, was World AIDS Day. So we want to make sure that we um, bring that up and talk about the significance of World AIDS Day, which we will do before we get deep into our topics. But for all the people in the Tallahassee area, we just want to let you know that this Sunday, December 6th, from 2 p.m. to 5 p.m., Neighborhood Medical Center will be providing free COVID-19 testing at the Northeast Branch Library, the Leroy Collins Leon County Public Library. The address is 5513 Thomasville Road, Tallahassee, Florida 32312. Once again, that's the Northeast Branch Library at 5513 Thomasville Road. So you can come and get a free COVID test. It's drive-through only, and please have a mask on. And make sure you check out yesterday's podcast, because we would normally release our podcast on Wednesdays, but because of World AIDS Day, we released our podcast yesterday on December 1st. So make sure you go back and check that podcast out, because we gave a lot of good information about what World AIDS Day was and everything that's around World AIDS Day, plus the events that happen during World AIDS Day. So make sure you go and check that out.
That's right. And I just want to say also that library, the Northeast branch of the public library, is across the street from Walmart.
Yes. And we also have a couple food distributions coming up the week of December 19th. So the week of the 13th through the 19th. So that Wednesday, December 16th, we would be doing our free food distribution here at 438 West Brevard Street from 9 p.m. to 11 p.m. Our second harvest food distribution. Come one, come all.
Come on.
Look, we got so much food, it's ridiculous. Come get you some.
Come on.
And then we're working on setting up, finalizing our farm share food distribution for Saturday, December 19th in Havana, close to our Havana location for Neighborhood Medical Center. So we're getting our final details together for that, to be able to feed the Havana community as well as the Tallahassee community that week with food distributions. So come one, come all, tell a friend, because if you hungry, we're going to try to make sure we feed you. You heard me?
And Joe knows about food. Joe loves to eat.
Look here.
He is tall and thin, but he loves to eat.
Don't let him fool you. We'll eat you out of house and home, okay? So we are gonna give our spill on World AIDS Day and go back and recap some things. But today's focus is going to be the state of our state of health, our state of being in the current state of COVID
That's right.
here in just the United States, period, especially in the southern U.S.
That's right.
How is the presence of COVID impacting those who have HIV? How is COVID impacting those who have compromised immune systems? Are people really going to take the vaccine? What do you know about the vaccines? Or do you care about the vaccines? All those things we want to talk about, and the impact of COVID during the holiday season as well.
That's right.
So,
That's right.
so before we jump deep into it, though, so Miss Steeple,
Uh-huh.
how long have you been working in HIV/AIDS prevention, or just in healthcare? Period.
Oh gosh, since 1990 in healthcare, period. But with the HIV AIDS population for about 10, almost 10 years.
Okay.
It's 10 years.
Okay.
So I've seen a lot, and I've seen a lot of public health problems impact
Right.
the HIV communities. So
Right. Okay. So you and I been in around the same amount of time, and World AIDS Day has always been, it's the biggest day in the HIV community as
that's
far as
right.
awareness and education. Um, what does World AIDS Day mean to you? And not in the sense of what, like the normal definition of World AIDS Day,
Yeah.
but just from
Yeah.
your perspective, what does World AIDS Day mean to you?
World AIDS Day means um, looking at the situation with HIV from the beginning to the end,
Right.
and appreciating just how far we have come in the world of HIV/AIDS, and being grateful and thankful for those scientists and researchers such as Dr. Anthony Fauci, but
Right.
then also the activists, ACT UP, or they were the ones that really galvanized. It's a group called ACT UP,
Hmm.
and they're out. Actually, they have several chapters across the country, I think across the world, that really, at the time, President Reagan didn't want to acknowledge. I mean, he rarely said HIV,
Yeah.
and they really just kept it in his face. And it's because of the activists, the dedicated researchers, the providers that took care of these individuals.
Yeah.
It's really reflecting back on the history of
Yeah.
HIV.
Yeah. As you were saying that, you made me think about it from an international level.
Mm-hmm.
There was a gentleman in the country Burkina Faso. He became the president and changed the name to Burkina Faso, but his name was Thomas Sankara.
Oh, okay.
Thomas Sankara was a great freedom fighter for his people and a great leader when he became president. But one of the things he did was make HIV/AIDS a national issue in Burkina Faso, and
Oh,
he became the first African nation to make HIV/AIDS prevention a national issue, something that we're going to put funds into, and we're going to put massive efforts into helping to prevent and to fight HIV/AIDS. So that's one of the things I thought about when you were saying that. But for me, World AIDS Day is, um, especially for providers, for those on our side,
right,
it's
right,
it's a day for us to kind of recalibrate, reset, uh,
right.
reflect, celebrate,
Mm-hmm. Mm-hmm.
mourn if we have to,
Mm-hmm.
but to really take a look and assess what we've done over the past year.
That's right. That's
Because
that's a great
you,
point, Joe.
you know,
That's a great
because
point.
it comes at a unique time. You could basically say World AIDS Day is the new year for the HIV community. You could basically say that.
It's like a Chinese New Year,
Right, right, exactly,
or the Jewish New Year.
exactly.
It is. That's a very good point, Joe. And yesterday I had a chance just to kind of sit down for like 2 minutes, and I basically reflected on the patients that I lost this year to HIV/AIDS, and even the previous years. I reflected back on those individuals, and I just asked myself, did I do enough to help them, and what were other contributing factors to their passing? It wasn't just the anatomical, physiological piece of HIV that got them. There were other extenuating pieces.
Yes.
Would you agree to that, Joe?
Yeah.
That it's not just that can take somebody out of here.
Yeah. Well, just getting people to understand that COVID-19 is one of the things that would exacerbate opportunistic infections or exacerbate anything going on within the body. You might not even be HIV positive, but if you any other health issues, especially issues surrounding the heart, lungs, and kidneys,
diabetes, high blood pressure, high cholesterol, I agree, and I think in one of the individual's circumstances, he was not accepted by his family, so he. I think that played a little bit of there's no point in me staying around. I might as well leave, because the family, even 2020, the family was not accepting. And so, Joe, what do you think about the impact of extenuating outside circumstances or factors such as like a family's lack of support or stigma, or what is your take on that?
Well, people have to realize the impact of a person's mental state. Right. So if I'm HIV positive and I don't have support from my family because they have views about HIV that may not be healthy, or views that are disparaging, on top of other health issues that I may have going on, may or may not. But in my mental state, if your mind is gone, everything else will follow.
That's right. That's right. I agree.
Not having support, not just from a mental standpoint, but from an emotional standpoint as well. Not having support will cause that, or can cause that person to go into a depression.
Yep.
It can cause that person to seek support in places that are unhealthy.
That's right. That's exactly right. That ties into the old saying, "Oh, he died of a broken heart." Right. Because things like that can impact a person's mental status. There's a mind-body connection, folks. Don't be fooled in thinking that there's not, because the mind and the body, they're one. So how do you think us, Black people, looking at the television and hearing how, COVID is just striking us left and right? I mean, we're that racial group that or the ethnic group that says COVID is coming after us. What do you think? What do you think the impact is or can be on those of us who sit there and internalize that information?
Oh man, well, it'll be another layer of a disparity that a person has to deal with. Because dealing with, first of all, being that COVID is what they call a cousin to HIV. So with COVID being its form of retrovirus and having its effects on the body and similar effects as far as replication as HIV within the body.
That's right.
Understanding that it would definitely compound a person's issues, but the thing about COVID though is, I know I got a lot of pet peeves around it, because within our community, just being honest, I haven't seen a lot of I'm seeing people in our community not take it serious.
That's right.
So
So do I. I see
right.
that very much so.
So
Yeah.
because it's one thing if I'm not educated on COVID-19, because everybody's not in a position to be educated. So those who are not educated, it's on our job. It's on us to go out and educate those people.
That's
But for
right.
those who are educated about COVID, I'm just it's and this is not directed to people in the HIV community. It's just as a whole general.
People in general.
When I'm seeing you walk around with your mask on like this, like this. What are we doing? What are we doing?
What are we doing?
Seriously, what are we doing? You ain't protecting nothing. You gotta come on now. But
if you think about it, Joe, where do they test you? They go right through
in your nose. Right. Look, that's a great point. I haven't said that point yet, but that's a great point because my whole thing was your nose is an integral part of your respiratory system. Guess what? Guess how you breathe when your mouth is closed?
Hello.
Right. But a great point. They test you. The most effective testing for COVID has been through the nose.
Right.
So
now, why wouldn't you want to cover up that?
Well, so and those are people who haven't had that thing stuck down the back of their neck. If you've never had a COVID test and they stick the thing, sometimes feel like it's gonna come through the back of your head. It's very uncomfortable to have that the thing about this long and it's stuck down your neck, and it's like, luckily the nurse who did it here, luckily she's gentle-handed, but you still feel it poking through the back of your head. But I'm just going through that. It's like, okay, we have to make sure that people understand the seriousness of this. And especially if we turn to those who are immunocompromised.
That's right. And it's not just HIV/AIDS. It's the senior population. It's someone who has lupus. It's someone who has diabetes, high blood pressure. You don't have to have this blaring infectious disease to be. And do you know, even when you have the common cold, you're immunocompromised.
Yeah.
Your system is already being beaten up, and the immune system is working overtime to try to fight whatever is bothering you. So your system is already worn down. Even when you have allergies, how many people come in and they sound really congested,
yeah.
Their eyes are bloodshot red, and they're like, oh no, it's my allergies. Okay, you're immunocompromised then. So don't just think that you have to be walking around with a blaring disease. But that's a good point though, Joe, as to the mask wearing. Can you elaborate a little bit more on the mask wearing?
Well, we're wearing masks for a specific reason, and the main reason is so the wearer of the mask doesn't spread it to everybody else.
That's right.
So yes, we are wearing the mask to not contract it, but the purpose of the mask is to prevent transmission. So if I have COVID-19, and I'm coughing or I'm sneezing or I'm just talking or just breathing, period. Because a lot of people, when they think about aerosol, they don't think about just talking, but think about the amount of spittle or air that would come out of your mouth just talking. Just now, just a lot of juice in this left and right. So just that alone makes it imperative to wear the mask. So let's say you don't know if I am COVID positive or not. And I'm just around here talking with no mask. I'm going to increase your chances of contracting COVID. But if I have this mask on, I'm going to increase the chances of keeping the COVID to myself.
And Joe, do you mind looking at the front of your mask and tell me if you see the words Republican, Democrat, or Independent or is it just a plain mask for any and everybody? Nothing political about it. Are those words in that mask?
Hey, there's nothing political about a COVID-19. There's nothing political about it. And how you know? Think about it. The president of the United States, we're not gonna say his name, but the president was one of the main detractors against saying that it's not real, it's not real, it's not real. And then he got it.
Yes.
So now he's like, it's very real. It's very real because he got it. But to hone in on your point, we've seen people get it no matter their political affiliation. We've seen people get it no matter their financial status, no matter their educational status, no matter their racial status, no matter your gender, no matter you could think you a Thundercat, you can still get COVID-19. You can think you a now later, you can still get COVID-19. It doesn't matter.
That's right. It's no respecter of person. Trust me. We deal with infectious disease every day. Right. And we have yet to see it discriminate. So,
let me ask you this. Okay. Being a provider that works directly with HIV patients, have you seen an increase in COVID-19 numbers for your HIV patients? And if so, how has it affected their health?
Well, I haven't seen an increase, but I have seen more than what I thought I would have seen. And as a matter of fact, oh goodness, I was talking to one of my patients the other day, and he came from one of the hot spots in the Southeast, but he came from one of the hot spots, and he was checked 3 times. 3 times. They all came back negative. Now, this is within a 10-day span. All came back negative. He still felt horrible. He goes back. It's the 4th test. The 4th test that showed him as positive. How many people was he around when he said, oh, no, I had my COVID test? I'm negative.
So what type of testing was he?
He did the PCR. He did the nasal swab, but that's why they tell you really should quarantine yourself like that 14 days. Because guess what? He tested positive on his 11th day. Right. 11th day. Right. Well, now, he could have gone on and said, oh, those other 3, I'm negative and walked out. But you know what he told me? He said, Miss Steaple, he said, I remember they said, stay inside for 14 days. His 11th day, he turned up positive.
Yeah.
Can you imagine?
Well, that's why protocols and things are in place. But another thing that's kind of got into a pet peeve for me is the overnight virologist. Because everybody's an expert on COVID-19. That's why go back and check out our episode with Dr. Sharon Foster.
Oh, that was excellent.
Did a great job of breaking down what COVID is, how it works in the body, all those different things. Go back and check out that episode. It's on YouTube right now.
Yeah.
It's on Anchor. It's on all of our platforms right now. And that episode she gave a lot of real good information, real factual information on what COVID actually is. That's right. But you got a lot of overnight virologists who have become some type of experts, this and experts that. Like there's information out now that when they were doing trials for a HIV vaccine, one of the medicines that they were using during the trial, they saw that if it was a continued use of this medicine, the use of that medicine in conjunction with unsafe sex habits could lead to an increase, or it could compromise the immune system, make it more susceptible for contracting HIV.
Oh,
But they
wow.
found that in the trial stage and discontinued that particular drug and all those things there. And so they're trying to link that to COVID-19 vaccine, where they're trying to take things from trial stages and say that this is definitely what's going to be in the final vaccine. And it's getting people to understand that there's a difference between trial level and the actual finale level. So there's a lot of information. Hey, there's a COVID, there's going to be a drug in the COVID-19 that can increase your chances of getting HIV, but still getting people to remember, I can't get HIV just like if I'm just sitting and I don't move. I can't get HIV. Like it still has to get to my bloodstream.
That's right. That's correct. And do people understand that just how transmittable this COVID is? I mean, it's so easily transmitted. It really, really is. Nowadays with HIV, let me tell you, when you go to give blood or plasma, if they have fine-tuned the machinery and calibration so well, you only get to a certain point and they go, nope, you need to get checked out further. Yeah. Years ago, before the modern medicine really latched on to HIV, people would slide through the plasma and their blood, infected blood, would be passed on to someone else. Now at the plasma centers and blood banks, you get this far and that's it. And so you really, there is listen, vaccine, Joe, does not equate to we know everything about COVID. That's what people are thinking, that we have figured out this virus and look out virus because we got that vaccine. Having a vaccine does not mean we know everything about COVID. It does not mean we have figured out how to get rid of COVID. I got a question for you, Joe. I got a question. It's an infectious disease question.
All right.
You ready?
Go ahead.
Name the infectious disease, there's only one, that has been eradicated from the face of this earth.
Come on, what, polio?
Close. Take another stab.
I would say MMR, but we know we had a resurgence of that.
Smallpox.
Okay, I was trying to think. That one was escaping, but okay, smallpox. I was close.
You were very close. Smallpox is the only infectious disease that has been eradicated, that has been wiped off the face of this earth. Right. And because of that, what does that say? There are still infectious diseases out there.
There are a whole bunch of infectious diseases out there, but also we have to look. All right, in America specifically, we have to call attention to the lack of just personal care. Like human beings have done a horrible job of following orders, following rules, just keeping themselves safe. Everybody wants to do what I'm still seeing. Look, if I see another gathering with adults and children,
right?
Adults creating events with children, mass gatherings with children, and half wearing a mask. There's no social distancing. We don't know anybody's status. And COVID numbers are going up. They are rising. Matter of fact,
That's right. That's right.
The world-ometer. The world-ometer numbers, because
isn't it over 7 million for the case, or over 11 million for the cases?
As far as in the United States?
Yeah.
So worldwide there's 64 million.
Oh, my Lord.
Yeah, so 1,496,707 deaths and 44 million recoveries. That's worldwide. as far as numbers by the country. So
Uh-huh.
for the U.S., according to worldometer.info, U.S. has 14,261,928 cases. There's
Oh,
151,000 new cases. So we look. India has over a billion people. So
and how
India
many?
is second. India only has 9 million cases,
Oh,
but India has over a billion people. India has 3 times the 4 times the population size of the American. They only have 9 million cases. We got 14 million cases, right? But we know it's people wanting to do what they want to do. I'm not wearing a mask. I don't believe it. It's fake. This is fake. That fake news. Fake. 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 Like people are dying, like theatrically or something. This is real. But we within the black community, we know that if my thing is we're always saying when America catches a cold, black people catch the flu.
that's right. That's
So
right.
we're always saying that, but I'm observing our community
Hmm.
not paying attention and not adhering to the protocols to keep us safe. Like in certain communities here, there has never been any safety precautions taken.
Oh,
People
wow.
are still mass gathering every day as if it was last January. People are not wearing masks. Like certain stores I go into, they're just letting people walk in with no mask. And it's like I don't know your status, you don't know my status, people don't know this, people don't know that. People still want to have certain events, they still want to do this. Like if you were trying to have an event in to help the community during the COVID pandemic, but you're causing people to gather, you're not helping the
You're
community.
not helping. But see, Joe, it some individuals, they think monkey see, monkey do. Well, this person's not wearing a mask, so apparently it's safe. No,
Okay.
it's not. But see, that's how a lot of people got infected because they saw the head of our country not wearing a mask and thinking it's safe to do that.
But see, I don't get that. I don't care who the president is. Guess what? You're not an expert at.
That's
If
right.
this is not your field of expertise, I'm not listening to you. I don't care. I don't care about you being president. I ain't gonna listen to you on no health matter when you a businessman. Now, if you talking business, that's different. If you
That's
talking
different.
health,
That's
I'm
different.
not listening to you. That's the same thing. If you believe that, bring your car to me and let me fix your engine.
That's right.
All right. I'm the third string IT at this job. Third string, and I place myself in that position. Let me fix your engine if you believe COVID ain't real, because I can fix your car for you.
And I'm 10th string for technology. So bring your computer to me.
You know,
Yeah.
but
Okay.
but I do get what you're saying though, and that's one of the issues though. People who people see as authority figures, and that's something I always talked about within HIV.
That's right.
If
That's right.
if authority figure or a person who I trust tells me something, I'm going to take it to the bank.
That's right. That's
So
right. That's
so
right.
let's say let's hypothetically let's say my uncle taught me, hey, if you have sex standing up or you have sex in a hot shower, you'll never get a girl pregnant.
Right.
Well,
Nah,
we know that's not true. But it's the presence of the authority figure. It's the respect that the authority figure
that's right.
or you have for the authority figure, and that person may or may not be malicious in their intent to misinform you, but because they don't know and you're listening to them, now you are misinformed. But remember, as long
That's
as you
right.
got these that are called cell phones, these are literal computers. You got
That's
access to all the information in the world and multiple sources that you can access. Don't just
that's
go to the first source. Multiple sources that you can access to help um, inform you about everything that's going on, especially COVID and how it's
that's
affecting our health. Like we got over a million cases in Florida now. Well, over a million now.
But see, Joe, that with you saying that, that just reminds me to get once again on my soapbox about not get your blood pressure under control, get your diabetes under control, get your body in the best shape possible. if it comes knocking at your door, how many people did you say are infected in the U.S.? 14 million?
Yep.
You're,
14 million.
what do you think your chances are of coming across one of those people?
Hey,
Right?
hey, look, it's greatly increasing. It's greatly increasing. Like you can't be the person who just says, well, you look like you don't have it. Well, what does COVID look like? We still don't have. We've never seen what COVID looks like as far as hey, this person don't look like they have it. Like, okay, I don't know what that means.
I don't know what that means either. And so therefore, if you are if you're a minority, if you are Black, Latinx, transgender, Asian, Indian, if you please get your bodies in the best shape possible.
Yes.
So that when it comes knocking at your door, if and when it comes knocking, you would have positioned yourself.
Well, yes. Well, and like you say that, especially during these holidays and holiday seasons, as far as being healthy, we know traditional foods.
That's right.
Like we're having a conversation yesterday about ham.
Oh boy.
And we know the salt content in ham.
Ooh, ooh,
I'm
ooh.
not telling anybody to eat ham or not to eat ham, but we were literally talking about the actual salt content in ham, and just the salt content and the cholesterol and all these things that especially our community, how we traditionally cook.
That's right. That's right.
We have to change. We have to
change. We have to. I mean, you know what? People look down on 2020. They're always saying, "Oh gosh, 2020." No, 2020 is the year of change. You know how the Chinese have the year of the dragon? 2020 is the year of change.
Look, the only thing different from 2019 to 2020, the only thing different was coronavirus.
That's it.
That's it. The year wasn't that horrible. The year wasn't bad. Everybody acting like no. The difference is if you take away coronavirus, this year would have been the same as last year, the years before that.
Would have been the same because
including police violence and everything.
That's right.
Would have been the same.
And we still would have had a crazy secure election. We still would have had that. The players still would have been the same players. And so when I look at 2020, I look at how COVID came in, and COVID said either you're going to adapt or you're not gonna make it.
Well, plain yes. Simple. Well, also in the South, okay. Yep. Remember, the COVID map looks a lot like the Republican map, which it looks a lot like the HIV map, which it looks a lot like the obesity map.
Right.
Right. So the red states, the southern states, the Bible Belt suffers the most.
Out of everything, it seems like.
Out of it's time for a change. It's time for we have to get out of this. Our traditions are killing us. Literally, our traditions are killing us. I don't care how mom did it. I don't care how grandma did it. Let's create something new moving forward. We can honor our ancestors in their health field.
That's because remember, mom and dad and Aunt B, once they ate, they went back out in the fields and they worked it out.
Well, yes. Like imagine it's a gentleman. I remember doing when we was doing outreach, HIV outreach. We was also partnering with FAMU's nursing students. And we were at Tony's convenience store on Lake Bradford.
Okay.
And it was an older gentleman walked up. I don't know his name, but I call him Mr. Walking Man because I always just see him walking, like literally walking. And so the ladies was like, "Hey, come up and let's get your blood pressure." I told him from the jump, that man blood pressure gonna be good. And I was thinking because he looked like he was homeless. He's not homeless, but he looked like he was homeless. It was like, nah, he probably gonna have high blood pressure. Look, I live in this neighborhood. I see this man everywhere. This man walks everywhere. His blood pressure is gonna be good. His blood pressure was excellent. So just building on what you said, there's one thing to eat certain foods, and then the quality of the foods, the quality of the meats and things are healthy. So we got better quality meat, and we're doing physical activity. We're working. We don't have a sedentary lifestyle. So having a sedentary lifestyle.
Joe, did I tell you? I started on Sunday. I have an above ground garden.
We're going to grow some stuff out there. Yes, but that's
Guess
good.
what I planted?
That's
Guess
good.
what I planted?
What's that?
Spinach.
Okay.
Which is a cold weather veggie.
Right.
Kale. Green and leafy. And let's see, I did spinach, kale. Yeah, spinach and kale.
Good. And guess what? For others who are like, hey, well, I'm interested in gardening, even if you live in a quote unquote food desert. So like here in Tallahassee specifically, I know the Tallahassee Food Network and I Grow Gardens. So there's an I Grow Garden on Dunn Street.
Oh.
And there's an I Grow Garden by the Hollyfield Projects on Texas Street.
No.
And I know the Providence community of Lake Bradford has a community garden. We know about the one across the street from FAMU High. There's a community garden down Roberts Avenue when Roberts Avenue meet Patrick Avenue. And there are several other community gardens, but just like you were saying, you can start your little garden in your backyard. But even if you don't own the land around you, you can do like in-home gardens. You can make a garden. People take the little plastic shoe racks, put the potting in things in.
Right.
So there's things that we can do to help improve or help our health, especially in these times of COVID. We have to make sure that we don't have the largest number of health disparities on top of COVID existing.
Because one thing I do know, Joe, I know that if Second Harvest runs out, I know I'm gonna go right out to my little garden.
Hey.
And romaine lettuce, that was the other one.
Right.
I'm gonna pull up whatever is available, and I'm gonna have something to munch on, and I know it's gonna be healthy. So I mean, this has been a great conversation today, Joe. COVID, folks, please take it seriously.
We have to. We need you. We need our community. We need everybody in this country and our community to take COVID-19 serious. Don't fall for the conspiracy theories. You know how to read. You know how to think for yourself. Read and think for yourself. Research for yourself, and research the information that you research to make sure you're not getting some kind of fly-by-night information. But we wanted to kind of talk about the impact of COVID, update on COVID. We know where we are. We see how COVID is impacting the community, and just encourage people to, first of all, please properly wear your mask.
Please.
Cover your nose with your mask.
I see that. Please.
Cover your nose with your mask. Look, listen. Going into the store like this with your shirt, no, that doesn't help. Your shirt will not help keep you safe from COVID. It won't. But so things like that. They check the numbers from time to time of COVID and see what's going on in your area. I know we've had an increase in Leon County here and Gaston County. We know the presence of students help with that.
That's right.
And we're not even going to get started on the parties and gatherings and things like that with students. They should have just shut the city down. I don't know.
You know who you are. Please stop that. Please, because you're putting your community in danger.
Putting your family in danger. If you want to go back home, imagine you having to party so bad that you go out and party, you contract COVID, and you bring it home to your loved one and have a bad reaction from COVID, all because you just had to party that bad.
You just had to. So folks, please, let's just listen. Nobody is trying to take away your rights. Nobody is saying that you are less than a person. But please, we're put on this earth really to take care of one another. Whether or not you want to believe it or not, several people don't want to, but there's that verse in the Bible. Am I my brother's keeper?
Right.
Yes. Look out for your brother. Look out for your brother and sister.
Seriously. And remember that COVID-19 helps to exacerbate or increase the health issues that you may already have.
already have.
So let's reduce
Good point, Joe.
our chances of contracting COVID. Let's reduce our chances of having other conditions or other opportunistic infections. Let's be healthy all the way around. Let's make sure we do that.
That's right. That's right.
So with that being said, moving forward, we are going to plan on having a series of men's health podcasts moving forward, dealing with diabetes, heart disease, obesity, oral health.
Oh, wow.
All these different things we want to have bringing up to y'all. Fitness gurus we got planned on coming up, talking about health insurance, all types of stuff that we got planned for you all.
Tell your friends. Tell your friends. Listen in. Listen in. We have some
podcast ever.
Yeah, we have some
podcast. NMCpodcast.com, NMCpodcast.com, NMCpodcast.com. We're on YouTube, Neighborhood Medical Center on YouTube. Subscribe, like, comment, subscribe, share. Like, comment, subscribe, share. Like, comment, subscribe, share. Like, do it. And remember, because they got a little strange thing with the algorithm that if you like, comment, subscribe, and share, more people can see it. How about that? That's so magical, right?
Oh,
magical.
Awesome. Awesome.
Hey, so
I like that.
Mind Your Body and Soul, the healthiest podcast you will ever come across. I am Joseph Ward. She is
Alana Steaple.
Alana Steaple, aka Dr. Staples. Shout out to Mathias Sweet. Shout out also to Ian Costello for all his help behind the scenes.
Always.
And forward, we're gonna have some great things for you all. Remember, we're on iTunes. Not iTunes. We're on Radio Public. Hello, what? I'm just saying all the wrong stuff. Let me bring this up right so I can see it.
That's our cue, Joe.
Real quick, we're on Anchor, Breaker, Radio Public, Pocket Cast, Spotify, Google Podcasts as well. So, with that being said, she's Alana Steaple. I'm Joseph Ward. Mind Your Body and Soul. Peace out.
Peace. Bye.